Hey everyone, this is Kieran. Today's exercise is looking at how to develop some dissociation between your sort of thoracic, cervical spine and your shoulder blades. Really useful skill to regain after a neck or thoracic injury or even a shoulder injury. But you can also use this to build some shoulder pulling strength. So just a really nice overall exercise. So one of the key skills that I see lost when you have people that have a history of potentially like lower cervical pain, thoracic pain, so there's space in between your shoulder blades up here, or even like one shoulder or generally just both shoulders having some issues, is kind of the ability for your thoracic spine to extend, so that's to go backwards, right? And then your shoulders, and particularly your shoulder blades, to move independently up this. And what it means is that these things can go in different directions at the same time, or they can go together at the same time. And these are just the skills you need around this area, this ability to dissociate or associate. And why does that happen? It could just be from, something's painful or not comfortable, and so you avoid doing it for a while. And then maybe you stop doing that task. Maybe it was a sport, for example, and so you stop playing the sport because of the pain or the discomfort, and then you lose that skill. Or it could just be like, that thing hurt me before, and if I do it again, I think, well, maybe I'll hurt myself again. And then it creates this, sometimes an association between two areas where they brace and protect with each other, or it can create a thing where these things struggle now to work together and share some load. So this is one of those exercises which kind of highlights that quite a bit for this region of thoracic and cervical spine. Now, any exercise has that capacity. It just depends how you cue it and the intention behind it, and also identifying if those things are triggers for someone's symptoms. It's one thing to see these objectively, and it's another to connect it with someone's symptoms. And you have to do the assessment, see that that's difficult, and then see if their symptoms come on. If their symptoms don't come on, then you don't necessarily have to focus on that unless it's a meaningful movement or someone's motivated to try and learn that skill. Whereas if their symptoms come on, then you want to try and modify or improve the ability to use that area, and then you might notice that person's experience of uncomfortable symptoms starts to be alleviated. Okay? Now, here's why we're going to talk a little bit about what to use. Now I'm just gonna, I think I'll change the frame for this one, guys. So what we're considering when we're thinking about what piece of equipment to use is, well, there's lots of things. Could be the weight and the speed of what you're trying to do something at. You're trying to stimulate a high threshold motor unit thing, which is, can I recruit a lot of the muscle and use it for power? Or can I use less weight really quickly? Now, in this scenario, we're considering the range or the ability for things to move together. Now, if I have a rigid thing like a bar, so something like this, then that means that my body has to be a little bit more flexible around it because the bar is rigid and I can't move the bar. Now, if I used a dumbbell, that's a little bit more flexible and movable, and so my body's flexibility requirements aren't as high then. Now, there might be an argument for both at different times, but in this specific scenario where you're trying to create a dissociation or an association between an area, you might want to use a rigid element to create an emphasis on the areas that are moving, and that way your hands are a little bit more rigid. Cool? So, nice little thing to think about. How do you know? Play around with it and see what allows you to execute and actually complete the skill that we're trying to improve. So there's some fundamental skills that you need to learn first with this. If you can do it, then you'll feel like you can do this, and if you can't, I'm going to link a video up here, and it's a video about learning to use your head and your neck and your thoracic spine. And that's because some of the muscles that we're going to try to emphasize use of here go from the back of your head, they connect back here, and they go all the way down to your T7, and so they help move the spinal segments between your shoulder blades, and that's a really important thing here. Because the shape we want is this. If I come over into this position of being bent, I want to be able to pull my head towards the sky. Now if I let my head drift to the ground just to make it more obvious, can you see how my spine up in here, so in my shoulder blade area, flexes forward? Now it's not bad to pull from here, but can you also pull from here? And what I'm trying to do, you can see my lumbar spine isn't moving massively, it's happening more up in my thoracic spine. But that movement is coming from me asking my head to go backwards. If I don't ask my head to go backwards, then I'm going to try to create it more from the pelvic attachments. And so you can see my lumbar spine move more instead. So if I allow my head to drift down here, and I create that sort of flexion in the thoracic spine, I don't allow my head to come down. If I'm trying to create the thoracic extension up in this area, this upper back, you're going to see that I have to also move my lower back for it to occur, right? Now again, that's not bad, it just means more effort. If I do the head component instead, now my lower back doesn't have to change. And so you're just trying to get a sort of equal-ish or a movement that allows both areas to work harmoniously. And what does that mean? Non-symptom provocation and allowing you to complete the task, okay? So the setup first is being able to bring that head back. And if you can't do that, check out that other video that I linked before, and it'll teach you how to do that skill. So let's pick up the weight and do the movement, and we'll talk it through as I'm going. Now, a narrow grip versus a wider grip is going to ask my shoulder to go through some different ranges and also my shoulder blades. If I go a little bit wider with my hands, I'm going to have to do more shoulder blade retraction than if I went narrow, because now my shoulder joint can do more of the backwards movement or the extension. So it can go this way, and I can do more of that without my shoulder blade having to go back. If I'm wider though, it's harder to get my arm back as much, and so my shoulder blades have to do more. So it depends a little bit on what you want to develop. You could just do a variety of both. I'm going to go for more of a narrow grip. I'm going to bend into that position, and I don't mind if my lower back's a little bit flexed, that's fine, because I'm not asking it to be that much part of it. I need to pull the head away, so pull it away from the ground, and then I'm just trying to bring the bar up. And as I go down with my arm, I'm going to let the weight pull my arms down, but don't let the head get pulled as well. That's the skill we're trying to develop. And then as you pull up, you're trying to pull the bar through your body. If I go a little bit wider, see how it looks a bit different. And now my shoulder blades have to do more of the movement versus my arms, while I'm also trying to keep that head pulled backwards, okay? From the front, you can see the difference in the movement. So I'm here, bent over, pulling the head away, pulling the bar through, versus a bit wider, more of a shoulder blade movement. So slightly different. Okay. Another little thing to think about, when you're pulling, if you start to bend the wrist like this, not bad, but those muscles aren't as strong or robust at doing the pulling. So you might have to think about, well, am I moving my shoulder blades as much? Or my arms going back far enough? And maybe those aren't doing that. That's why the wrists are trying to help. So I'm going to go here. If I don't allow my arms to go further, I'm going to try and do that with my wrist to make it further. Versus if I pull the arms further and keep my wrist straight, then the movement has to happen up at the shoulder blades. So, straightforward enough in how it looks, but if that head movement's quite challenging for you, or you feel like your lower back gets a bit fatigued, then these sorts of things can be difficult. If your lower back gets a bit fatigued, doing this will make it stronger and last longer, but you might also find that a hand-supported pulling variation is useful, and if that's the case, I'll link a video here to that. You can kind of learn about that skill, but really useful exercise for starting to develop that dissociation and dissociation between those two regions. And as you get better at it, you can start increasing weight to whatever it is, the things you want to get back to. Hope you found this helpful, and if you've got any questions, then please comment below, and I'll get back to you. If you like this video, then please hit like below. Otherwise, to check out more of our content in the future, you can subscribe to our channel by clicking our logo over here, and to check out our latest video, click up here.